Suicidal ideation is a call for help, and this is the part where we as a society take into action to curb the issue. My name is Ameera, and together with my team, Zattiel, Nick, Asyraf, Ain, and Lan Ying, proposed this study on the rising number of the suicidal ideation among Malaysian youths during the COVID-19 pandemic, in conjunction with the acting on the call to Sustainable Development Goal 3, Good Health and Well-being. The statistics on the recent suicide cases due to the pandemic are worrying. Little that we know that this too gives a deep psychological impact towards youth. Many studies pertaining mental health issues, especially during COVID-19 period, were done on healthcare workers and children. But to date, there were still less study done on suicidal ideation on youth. Hence, this study aims to look at potential factors that could influence the suicidal ideation in Malaysian youths during the COVID-19 pandemic. This correlational quantitative study will be conducted through questionnaire by using stratified sampling. A total of 500 participants will be chosen, and the data will be analyzed using Stata software. Suicidal ideation is an alarming issue, yet rarely been discussed about, as it is considered as a taboo and triggering topic. However, there is a must in getting the conversation started, as the number of suicide ideation is rapidly growing. According to Maniam, it is assumed that the rate of suicide attempts are at least 10 times bigger than suicide rate. To define, suicide is derived from Latin words, which means to kill self. It is a behavior of an individual to take his or her own life. There are also 3 acts of suicide: suicidal ideation, suicide plan, and suicide attempts. Suicidal ideation is the thought of engaging in suicidal behavior. Suicidal plan is reflecting on his or her intention to die, and suicide attempt is participation in suicide behavior, which could result in failure or success. It is important to hold an intervention at the stage of suicidal ideation, so this matter could be curbed at the earliest stage possible. There are 4 problem statements of this study, which concerns the recent suicide statistic involving youths, stress which leads to suicidal ideation, ideas that suicide can solve existing problems, and lack of government competency. The first problem is on majority suicide attempts cases are concerning youth, which 90% of suicidal patients are youth. A study by Tamil Selvam noted that suicidal ideation among adolescents aged 13 to 17 increased by 10% last year. According to Hafizul, based on the reports by Royal Malaysian Police on suicide cases, trends were seen to be increasing each year. There were 609 cases in 2019, 631 in 2020, and just in the first half of 2021, there were already 468 cases, and it is expected to pass the 2020 rate. This was proven in multiple reports that COVID-19 outweighs the factors that could contribute to stress, thus leading to suicidal ideation. And this brings us to the second problem, stress in life. In light of COVID-19, Dr. Adam Baber, former Minister of Health, in Sinar newspaper mentioned that the pandemic caused many people to be unemployed, homeless, unsafe, and susceptible to the virus. The Employment Insurance System, SIP, recorded a total number of 99 to 100,000 workers were laid off as the result of COVID-19, and this undoubtedly affects psychologically and triggers the suicidal ideation. This could also be proven as 85.5% calls received by the government concerning public's mental health issues caused by joblessness, stress, financial strain, and more. The third problem is the alarming impression that suicide can solve problems. According to the Director of Health and Clinical Psychology of We Care Ally, Shazima Masud Shah, suicide may seem like the only out to the problem that may cause patients depression and other mental health issues. They will have a declined interest in life, isolation from society, and while this might not always be the case, they might do activities or behave out of the norm. Most importantly, they feel helpless, which is why this is needed to be addressed immediately. Lastly, the government's lack of competency. As mentioned, the government received over 140,000 calls for help, and the Consumers Association of Penang, CAP, is deeply concerned that these are only a fraction of number of a growing problem. Yet no actual solution were implemented. Other than that, the former Deputy of Prime Minister and now currently the Prime Minister of Malaysia, Datuk Sri Ismail Sabri, admitted that during the movement control order, many suicide cases were reported but was not made public. Although the government is moving towards decriminalizing suicide attempts, it is just as important that other proactive solutions were also taken simultaneously to curb the suicidal ideation. And that brings us to the research questions and objectives of this study. This study aims to identify the factors that could contribute to suicidal ideation in Malaysian youths, especially during COVID-19. Hence, the research questions are: does stress, joblessness, no source of income, financial problems, family conflict, relationship problem, lack of family support, and lack of government support could contribute to the suicidal ideation in Malaysian youths? The research objectives are to investigate the relationship between said factors with suicidal ideation among youths in Malaysia. Suicide is an international problem. According to the World Health Organization, suicide is the top 10 causes of death in the world and second biggest cause of death among youths aged 15 to 29. To paint a clearer picture on the seriousness of the issue, in Malaysia, 7 people will attempt suicide daily and 13 in every 100,000 succeeded. Among the well-known risk factors of suicide are previous suicide attempts, psychiatric disease, bullying, childhood trauma and abuse, including concerns on sexuality and gender identity. In light with the Sustainable Development Goals shared by the United Nations member, this study is called to fulfill one of the SDG goals. SDG comprises of 17 goals to confront humanity and the planet, as well as including targets that need to be met by 2030. This study focuses on tackling SDG 3, ensuring healthy lives and promote well-being for everyone at all ages. One of the outcome targets is to ensure reduction of mortality for non-communicable disease and promote mental health. This shows that the need of this current study. It is important to stress this as we are living in the epidemic and it is possible to make change. Hence, this study is not only to provide the data, but it is also a call to the government bodies and mental health institutions to strengthen their psychological and psychiatric services. COVID-19 has undoubtedly impacted our lives. It took a toll on our physical health, our freedom, and our consciousness. Although less studies were done on the direct relationship of COVID-19 and mental health, but it does has an indirect effect on it. COVID-19 forced us to be separated from our loved ones, which could trigger loneliness among other things. Lack of affection from family and friends could also trigger suicidal ideation. Needless to say, economy were also impacted due to COVID-19. Financial strain and joblessness are all related to suicidal ideation. Dealing with pandemic is not easy. Many get the sense of hopelessness to continue with their lives, and this too could affect their mental health. Studies done by peers on the effect of COVID-19 and mental health have also suggested that suicidal ideation increased during COVID-19. While there was still less study done that shows the direct relationship between COVID-19 and mental health, COVID-19 does affect the economy and physical health, which ultimately leaves a mark on mental health. Thus, this study is to fill the gap. And this is the list of independent variable as well as the dependent variable for this study. This study adopted a correlation and quantitative method, a stratified sampling on subpopulation analysis of 500 participants that were chosen by using Yamane on Slovin's formula. The inclusion criteria for this study is the participant must be aged 18 to 24 years old, a Malaysian, and be able to read and write in English. The instrument is a self-administered risk assessment Google form using a Likert scale questionnaire. The questionnaire consists of study information, informed consent form, declaration of anonymity and confidentiality, demographics question, patient health questionnaire version 9, and follow-up questions based on the research question mentioned. The study will go through ethical clearance, and once granted, the form will be spread out and collected and be analyzed. Using this data software, a descriptive data will be generated as well as the multivariate analysis using chi-squared and t-test. The dependent variable of suicidal ideation will also be analyzed as dichotomous variable. And that is the end of our proposal presentation. We must attend to this issue and save lives. Good day.